Diabetes is a disease that affects about 22 million Americans. In the state of New Mexico, the incidence of diabetes is higher than the national average. The state also has a higher rate of comorbidities. This is due to higher than average populations of Hispanic and Native Americans. Some other factors are economics and education. Medications for diabetes has changed considerably in the last decade. New medication classes have been developed, both orally and in injectable forms. These include DPP-4s, GLP-1s, amylin, and improved insulins. With diabetes being detected earlier and people living longer, there is increased likelihood of patients having the need to take an injectable diabetes medication. Advances in delivery techniques has made the injectable medications more accurate and easier to use. These advancements, especially in GLP-1s, has led to specific pen devices for delivering the medications. This has made it difficult for the nurse to stay abreast of the advancements in medications and their delivery devices. Ongoing training is necessary to keep abreast of the new medications, delivery options, and patient teaching strategies. As diabetic patients live longer, there is increased likelihood of these patients using injectable medications. Diabetes is a disease that has to be dealt with on a constant basis. The patient must be checking their blood sugar, managing the diet, taking medications, and mindful of factors that can lead to complications. Good self-management has been shown to reduce complications and comorbidities. There are 15 classes of anti-diabetic or anti-hyperglycemic medications now available. Even with this availability, more than 50% of all diabetics are not in control, with an A1C that is greater than 7%. It's estimated that the adherence rate for oral medications to be 65%, and for injectable medications, it is even lower at 26 to 52% in the year after initiation of basal insulin. It is even lower, 19 to 48%, for those on bolus insulin. Some of the reasons for noncompliance are medication costs, fear of side effects such as weight gain, needle anxiety, and complexity of the treatment regimen. One of the biggest reasons for non-adherence in type 2 diabetics is that it is chronic and not acute. Treatment regimen results are not readily apparent, and rarely are there symptoms that the patient feels needs treatment. In the acute setting, treatment relieves symptoms and improvement is noted by the patient. Many times, when a new medication is being started, the patient is overwhelmed with the amount of information. Follow-up teaching should be scheduled on a regular basis, but many times it is only done if there is an apparent problem. Being able to diagnose delivery problems requires the healthcare worker to be familiar with all the various types of delivery systems and requirements for each type of medications. Things like environmental storage concerns, delivery method and technique, and the injection site can all have an effect on the patient response to the medication. Having the patient do a teach-back while being observed can pinpoint many of the common errors that lead to poor patient response. Once an error has been identified, the healthcare worker can then work with the patient on correcting the problem. The stakeholders for this project include the patients, medical assistants, nurses, physicians, pharmacists, clinicians, and the health system. First and foremost, the patients are the primary stakeholders. Diabetes self-care management is the primary way that the patients can participate in their care and determine the outcomes and progression of the disease. Having accurate information and being taught the skills of self-care will lead to better adherence of monitoring and treatment. Better adherence of the treatment regimen can slow the progression of the disease. It can also lead to better A1C outcomes. This has been shown to reduce the likelihood or incidence of comorbidities. Working with the patients to overcome barriers to self-care and medication administration builds a trust between the nurse and the patient. Overcoming the fears of using a wrong technique or side effects and needle anxiety helps the patient to have better independence and control in their treatment and management of the disease. The health system is also a major stakeholder. When patients experience better A1Cs, have lower comorbidities, and have better self-managed care, readmissions and hospitalizations go down, allowing for potential savings. Using pen devices lead to better adherence to medications. While this is an increased medication cost through the pharmacy benefit, there are substantial healthcare savings in other areas. The nurses benefit by enjoying lifelong learning and having the opportunity to practice a skill that they may not be experienced with. The medical assistants have similar benefits as the nurses, being able to participate and learn a skill they may not have been exposed to. Pharmacist clinicians benefit because better adherence will make their reviews and medication adjustments more meaningful. If a patient is not adherent, then adjustments cannot be made with confidence. The community as a whole benefits anytime a member of the community has improved health. The potential for loss due to illness is reduced, and the drain on resources is also diminished, which benefits the community as a whole. The theoretical framework that is used is Orm's self-care deficit theory. The basis of this theory is that all patients perform self-care, but when there is a deficit in that knowledge, health can be compromised and healing is less than optimal. If a patient's understanding of their medication and treatment regimen is inadequate, improper administration can happen, leading to wrong doses, poor adherence, and poor control of the diabetes. Evidence has shown the relationship between lowered executive function and increased severity of type 2 diabetes within the framework of Orm's theory. By extension, by improving education, it improves the executive function and leads to improvement of the self-care of diabetes. By improving the nurses' and care team's understanding of the medication and injection techniques, improved patient education should result. There will be a consistency in information shared, and all members of the care team can reinforce what has been taught. This will allow for more opportunities for patient education. That improved patient education will have a direct impact on the quality of information shared, skills acquisition, and may even have an effect on patient adherence. The nurse education that is done with the project focuses on a 1-to-1 nurse-patient ratio and teaching simulation. Some alternatives that have been proposed was increased group education activities. While this would lead to additional education for the patient, it was felt that the staff would have more opportunities to teach one-on-one during their normal work environment. The design of the teaching project was to use a flipped classroom approach. A flipped classroom approach allows the staff to learn the basic information, what would otherwise take up time in a lecture, online. It allows the staff to proceed at their own pace and as their schedule allows, with a few deadlines in place to help keep the course moving forward. The staff would complete a series of modules, learning the basic concepts and device usage. The staff would then complete a classroom segment where concentration would be on the hands-on technique of using the devices and a simulation of a patient teaching. The modules were compiled in the Adobe Captivate program and then integrated into the health system's LMS for use. PowerPoint was used to create the initial slides, with audio recordings made separately. The compilation in Captivate allowed for knowledge check slides and a quiz to be added easily. The knowledge check slides were set so the staff could try them until the correct answer was selected, providing immediate reinforcement of the information presented in the previous set of slides. The quiz at the end was set to score the students' responses with one try. The passing score was set at 80%, and if the student did not pass, the module would be repeated until it was. Once the modules were completed online, the nurse had classroom time to practice with the various devices. Teaching pens from the different manufacturers were available for practice and to gain familiarity. The second part of the classroom time was then for teaching simulation. allowing the staff to practice teaching about a drug and the device of their choice. The staff then critiqued each other and gave suggestions that would improve the patient teaching. Simulations have been shown to increase learning and allows the staff to integrate the information learned. Cognitive learning theory is about the student being able to process the information learned, perceive how to apply it, and then make that application. Simulations are an excellent way to have that happen. The role of the nurse in patient education cannot be stressed enough. The nurse has more opportunities than some of the other healthcare professionals to provide patient education. The nurse can ask pointed questions, delve into technique, and employ teach-back methods to assess and diagnose self-care issues. The professional nurse has the critical thinking skills to work with the patient to solve issues with medication administration. While there is a place for lay people to engage in patient education, the professional nurse should be the one that has the responsibility to plan, implement, and monitor the patient's education. Health of the community is seen as a professional nurse's responsibility, and patient education is a part of that realm. Every member of the community is important, and the advancement of health of any member improves the community. The teach-back method is a patient-centered technique that allows for the patient to express what they know, and then the nurse to adjust the learning to fill in gaps if needed. When the nurse is knowledgeable about the medication and techniques for good administration, the patient and nurse can develop a trust in each other. This lends itself to improved communication. The patient is freer to express concerns and plays an active part in their treatment. Self-care, by its own definition, is one of the mainstays of patient-centered care. As the nurses and staff help to promote self-care, patient-centered care is realized. Interprofessional communication is a vital skill that needs to be stressed throughout the healthcare industry. It improves patient outcomes, improves the work environment, and improves collaboration among the healthcare team. Interprofessional communication includes synchronous and asynchronous communication, which can include verbal, written, body language, attitude, and tone. There are many barriers to good communication. Being able to recognize what good communication is, the differences in language and styles among the different professions, has been recognized and is a priority throughout the healthcare industry. Nurses can be one of the prime change agents by engaging in effective interprofessional communication. Some of the roles that were taken on during the project development were that of developer, researcher, actor, instructor, and leader. As the problem was being identified and the project was beginning to be defined, the leadership role was to present the idea to the educator for the specialty department and the department manager. Once that was accomplished, the role changed to the researcher. As data was gathered and the slides were generated, some of the different logistic issues presented themselves. One was that the version of PowerPoint that I was using at home did not allow for quizzes to be added into the presentation that could be self-grading or monitored. The Adobe Captivate program could easily be used to generate those types of slides and could use the PowerPoint presentations as a base. Since part of the program was to have this become an instructional piece that could be used every time a new nurse or MA was assigned to the department, the decision was made to use Captivate so it could be published and integrated into the LMS system. The IT department was contacted about installing the program on my work computer, but due to communications issues, that never happened. Multiple communications attempts were made by myself and the department manager, but that portion fell through. Since I found a trial version online, I decided to use that to make the Captivate portion, with the understanding that once it was finally installed on my work computer, I would republish the pieces to make them permanent instead of having a time limit on them. The participants had 3 objectives for each module. These outcomes and how each was evaluated were: the staff will be able to 1. List available injectable diabetes medications, and they'll score 80% or higher on module quizzes that depict identification of diabetes injectable medications. 2. To describe the action within the body of the GLP-1 agonist amylin, and insulins, and again score 80% or higher on the quizzes. And third, demonstrate how the various pens work and where to inject. The staff will demonstrate how the various pens work and correctly identify injection sites when completing the demonstration checkoff list. During the completion of the modules, each module had knowledge check questions at various points during the presentations. These knowledge checks were over the material just presented. These allowed the student an additional learning opportunity by allowing the student to keep trying until the answer was selected. Information is better retained and motivation for learning is higher when quizzes are often and soon after a learning segment. The quiz at the end of each module was graded and a passing score was set at 80%. By setting the passing score at 80%, then the objectives that required that percentage to be successful were obtained. If a student did not pass, they had unlimited opportunities to go back over the material and attempt the final quiz. The staff could not proceed to the next module until a score of 80% was obtained. During the classroom section, staff had the opportunity to try each of the various types of pens. Then they would use one of the pens during the patient education simulation. Each staff had a demonstration checkoff list, which was used to be sure they covered important aspects of patient education. Items on that list included environmental aspects, such as being at eye level, as well as patient-centered considerations. Patient-centered considerations included speaking at a level the patient could hear, letting the patient operate the pen device, and discussing and demonstrating with the patient the injection sites. A key element was to find out what the patient's preference was about where to inject and what fears they might be having. The teach-back technique was also on the list to reinforce the idea of using this method. Immediately after the simulation, group discussion was done to offer suggestions for improvement and to reinforce strong points. The group was small, and by taking the simulations down into teams of 3, it became more comfortable for the participants. The course evaluation form was then filled out by each participant. Staff indicated that they had an increased confidence in providing patient education. They also indicated that they had learned new material about the medications. The full significance of this project has not yet been realized by the health system. Staff report better confidence in patient instruction and in a better understanding of the newer medications. These accomplishments should reflect an improved patient education, which could lead to better patient adherence. Due to delays in getting the modules into a published form, participation has been limited. The staff evaluations are providing feedback for improvement. As these are completed, the value of the project should increase. A patient questionnaire to evaluate the patient teaching received will be another step in the improvement cycle. It's anticipated that the project will continue to be expanded so other departments can use the modules. The goal will be to incorporate this into the staff education on diabetes, first for the outpatient care managers and then the staff nurses. This is a separate project consisting of care managers, clinical pharmacists, and nurse educators from the various family practice and endocrinology groups throughout the health system. The significance to the overall health system won't be realized for some time. Patients of the endocrinology department had the benefit of improved patient education already and should steadily improve as the quality improvements to the project are incorporated. On a personal note, the experience I have gained by working on this project has been significant. I've been able to pull together resources, applied leadership principles, and research available medications, devices, and teaching strategies. As a culmination of my training, this project has allowed me to utilize the theories and best practices learned throughout the course of study. I've been a proponent of lifelong study, and this project is one more step along that journey. I've had several careers so far in my lifetime. Each has required continuous learning to improve in each one, which I have relished. I cannot envision not learning or studying some subject, even personally rewarding ones. This project was designed to fill a need in staff education. Due to the many new developments in diabetes medications and the specialty devices to deliver that medication, it is difficult for the healthcare worker to remain current in this knowledge. This, in turn, makes it difficult to deliver effective patient education. The project has been designed to fill that gap. Benefits to the patient, health organization, and the healthcare worker have been discussed. Improved patient education can lead to better adherence and effectiveness of the medication. This can lead to improved diabetes management for the patient. The health system benefits by better patient satisfaction and eventually lower costs because of improved patient health. The healthcare worker improves in their ability to assist the patient in the management of their diabetes.